Mike, what's up, man?
We finally made it.
Yeah, tell me what's going on with this traffic? What happened over there?
People don't know how to drive in northeastern Ohio.
Man, what was it? Did you see the accident, or is just
No, I didn't. I was just piled up behind traffic, but
how's the day work? What office were you in?
I was filling in for a doctor that was sick and just took out a handful of teeth today, did a crown prep, did some fillings, standard bread and butter day.
Too bad. That's good. That's
Not too bad. Not like you probably doing BSSOs and Laforts every day.
oh no, it's not. It's definitely not every day. You know those workups they take months. You got to work with an orthodontist. You may be able to work hand in hand. And oh man, the amount of no shows or like patients sick at the last minute. But yeah,
For
it's
orthognathics?
yeah, and you'll go a couple weeks without an orthognathic. It's not like you get it just all the time.
Yeah.
It's a lot of
I didn't think that you even wanted to necessarily do that anyway. I thought you just wanted to be a bread and butter oral surgery guy.
well, in order to do them, at least in New York, it's tough to find like a surgical center. So you have to do it at the hospital. In order to do it at the hospital, you have to get hospital privileges. To get hospital privileges, you have to take call. The call that you take, they're not paying you to take call and essentially do the work for them at the hospital on Long Island. So
So you could get called in at 2 in the morning for a baseball bat to the face, and you just got to do it. And there's no pay or anything. You just got to go fix baseball bat to the face.
yeah, it's pretty frustrating. I don't know.
I don't think I like that too much.
No, no, and I got a life to start to live as all people do, right? We put our life on the side for so many years, education, tests, years and years and years, the degrees, we got to live life a little bit for once. Hey, we'll see how it all works out. But
You've been in school forever now, my friend.
dental school is long too. It's enough. I had enough. I want to live a little bit. Let's
Well, I'm
work. Let's
happy that
put
you're in
Monday through
a good
Friday.
spot.
Are you working Monday through Friday? That's actually a question I want to ask.
I'm working Monday through Friday, yeah.
And you were telling me about how your mom owns a practice and you're interested in potentially looking at that as an opportunity for ownership in the future. And tell me about your wife a little bit too. So how's this combo?
We are working together to find a practice that is best fit for her and I. And we are looking at a whole bunch of different options and trying to find one that makes the most sense for her and I in terms of what we want to do. I think that she has a real passion for endo. She's very good at endodontics and she does a lot of complex care for rehabilitating patients with some bridges, with some crowns, with things of that nature, but just kind of bigger cases. And I do a lot of IV sedation, moderate sedation cases for patients who have a tremendous amount of emotional baggage. And I take care of a lot of special needs patients, which is why I definitely wanted to jump on here today with you to talk about special needs patients.
Yeah, yeah, special needs. How much are you dabbling in? Well, before we get there, your wife is more in endo, but she's doing mostly general dentistry in addition to endo, right?
Right, right. She does crowns and fillings in general dentistry, but I mean,
Yeah.
she's very, very good at endodontics and she's very skilled at being able to diagnose things well. I think that she enjoys the complexity of it, how every tooth has slightly different anatomy to it,
Yeah.
and she's very good at being able to kind of key in on those details. I don't know. I encourage her all the time. I say, sweetheart, I think that you should go back and become an endodontist because she's very passionate about it. But I think that she enjoys cutting crowns too.
Yeah, and I mean, hey, if she's good at it, she still does crowns. I mean, why not do it all? So you want to work with her in the future?
Yes, that's our plan. I think that we are very different people and different kinds of leaders, but we complement each other very well. We were able to go through 4 years of dental school together at Ohio State, and everything that I am, she's not, and everything that I'm not, she is. So I think that we definitely complement each other on where the other one. I just think that we're just a very good match for each other.
Yeah, the ultimate compatibility in the office, in the dental operatory, and out. Right? That's great.
Yeah, I would say so.
So we got to find you a practice. We got to find you a place where you both have your own areas, your own operatories. You can mix and match where you need to be, but you're looking for that. And so you guys aren't in the same office right now.
Not right now. No.
Got it. Got it. So that's the step forward. Does she have any dentists in her family?
Her dad was a dentist and her grandpa was a dentist and her grandma was a dental hygienist. So there's a lot of dentists in our family for sure.
Wow. Wow, on both sides, right?
on both sides.
Any offices on her side?
He's retired.
Gotcha. All right, so you guys look for an office together, see how it fits with your mom's practice, and the time will come. This all sounds exciting. This is great. So how was work today? Everything go okay? I mean, you went through all the cases and stuff. Did you have any special needs patients today?
Not today, but I have a backlog of patients, probably about like 7 or 8 of them that are trying to go to the operating room at our local hospital that I have privileges at. And we pretty much, we don't, for the most part, we don't know what the treatment plan is until we actually get to the operating room, which is very
Mm,
unique about special needs dentistry in the way that most of these patients, they aren't cooperative enough to for you to see any kind of clinical view of them, let alone get a diagnostic image. So we take them to the hospital and they're sedated, and then we take the x-rays in the operating room and we go ahead and make our treatment plan and just do all the treatment that's needed for that patient in the operating room.
that's right. I remember that from when I was at Bellevue Hospital too. They had some special needs days that they would do that, get the X-rays, do the clinical, everything once they're under anesthesia. It's really unfortunate that it's really the only way to do, and to do it safely too, right? Both for you and for the patient, right?
Yeah, I think that safety is key because you could try to make an attempt to do an outpatient moderate sedation, but with special needs patients, there's so many different complex variables to their medical history that I feel as though it's probably the most appropriate setting for them to be in, given that if something were to go awry, I want to make sure I have all hands on deck for taking care of whatever needs to be addressed.
Now, a quick question on the side note: does geriatrics dentistry fit in with special needs? I mean, it's really separate, right? But do you categorize? Is it similar? Is it different?
I think geriatrics, I mean, they it can kind of be somewhat lumped into special needs because it's definitely a unique population, especially for patients that have lost either their cognitive faculties or their manual abilities to, take care of themselves and brush their teeth or being able to manage a prosthetic. But I do think that they're very different too, because most of the time, unless the patient has Alzheimer's, I think that special needs patients are their own unique category.
Yeah, I would agree with that. Do you see more special needs versus geriatrics? Just special needs alone, or
Definitely more special needs. It's such a unique field, and it's more than just, I mean, you're doing dentistry, which we're all trained how to do in dental school, but there's so much bedside manner and communication skills that are a part of it, not only for the patient but the caregivers as
mm,
well, because you're trying to make sure that the caregivers are fully versed in understanding how we can manage this big case where they don't know what's going on, they don't know how to manage it, but they're trusting you to describe to them the process step by step by step.
yeah.
And beyond that, trying to manage it and maintain the dentistry that we do after the operating room is complete.
What's the most common thing you see with special needs patients that maybe like you see this with like very frequently with them? That you wouldn't see on like a someone without special needs, like a patient without special needs.
I mean, it depends on the nature of their condition, but I see a lot of malocclusion, a lot
Mm,
of tremendous either significant crowding or just poor alignment of the arches, which is something that you typically see in Down syndrome patients with the retrognathic maxilla.
yeah,
So that's another the reason why we take them to the OR Downs patients is because of the airway complications that can occur. That's something unique, but I see a lot of malocclusion, just a lot of just generalized wear and tear and heavy caries rate because they're
mm.
just not able to, they're just care of them properly.
A lot of sweets too, right? The diet can be tough sometimes as well.
It can be hard because a lot of them, they are either very picky or sometimes they don't
The access.
necessarily have appetite control, so they don't really know when they're full, so they'll just
Mm,
keep eating and eating and eating more carbohydrates throughout the day, which is a catalyst and the fuel for them to have caries development.
mm. That's like me at night, just stuffing my face with food. That's not good. That's not good. But yeah, just common things of Down syndrome patients. Yeah, large tongue, macroglossia. You got the thick, short necks sometimes, right? So that airway is just, yeah. That's why you wouldn't do any sedation in the office for them most of the time, unless they're very cooperative. But yeah, we would bring to the OR. That's what we would do too.
A lot of them, also Downs patrons have a higher risk of neck fracture because their vertebrae, their cervical vertebrae aren't as well developed compared to the average human. So that's something to keep in mind too. With flexing of the neck can occur in a dental chair. We like that's just another variable on top of it
Yeah,
on why more often than not Down syndrome patients are better suited to be seen in an operating room.
definitely. Have you ever seen that? Unfortunately, a cervical
I
fracture.
have never seen that. I've read about it in the literature. When I did my GPR training, I really tried to dig down deep and learn as much as I possibly could about these patient populations that we're seeing in the operating room, which is where I received my training. And I just tried to learn everything I possibly could. I did that just because I had a real big interest in it during that year. So I
Yeah,
tried to do as much as I could during that year I was at the hospital to become equipped to take care of these patients and be talking to you today.
yeah, yeah. Did you did a separate GPR area, right? Than your wife, right? Or was it the same spot?
Brittany, my wife, she did not do a GPR, but I did specifically because I've always just had more of an interest in medicine and surgery, and I felt like the combination of the operating room, the rotations in our hospital, and just being exposed to a high need for oral surgery in the hospital was what I wanted. So that's the reason why I did a GPR, and I don't regret it for a second at all doing that program.
Of course not. Of course not. You would agree that obviously, especially in your GPR setting, that you had a lot of OR experience. You got a lot of OR time, but we don't get a lot of that in dental schools. Did you get a lot of that in dental school? Going to the OR?
You could go to the operating room at Ohio State, but it was a very, very rare experience for a dental student to be able to go there. I considered going to pursuing OMFS for a brief period of time, so I tried to go and see the oral surgery guys in the operating room and just kind of stand in the corner when they were doing a case or something like that. But when I found out that general dentists could go to the operating room, mainly just for this special needs population, I felt that I could do a wide breadth of things. And I felt like there's not a lot of people that had a desire to do this kind of dentistry. And that's another reason why I just kind of went this path.
Why do Yeah, that's another thing. Why don't you think a lot of people treat special needs patients?
I mean, I think it's really hard. I mean, it's really hard because you don't really know a lot of their temperament, like how are they going to be acting? How are they going to be behaving? Also, sometimes the caregivers can be very difficult because it's very hard for them to understand how you're trying to take care of either their child or their family member or whatever
Yeah,
the situation is. So I think that there's so many different variables that go into it that are beyond what a straightforward MOD on number 30 is, that a lot of people, they don't want to spend the extra time to pursue this kind of dentistry. But I feel that if you do have a heart for it, it's probably the most rewarding thing that I've done so far in my career being a dentist.
is it tough to get into the OR, and then the reimbursement too? That's another thing.
So, in order for you to get into the operating room, you need to find a hospital that kind of has the infrastructure, I would say, to take care of dental patients. The hospital that I am associated with is a Cleveland Clinic hospital that has a GPR house within it as well. So they have the equipment, the ultrasonic, the oral surgery tools, everything that's needed for me to take care of these patients. But also they understand the flow and the rhythm of scheduling this unique kind of patient. You need to do a GPR in order to get credentialed at a hospital, and then you need to find a hospital that has the infrastructure already there to take care of them. In terms of getting an appointment slot for the OR, I personally have never had an issue with it, which is pretty nice because I know some people they're around a major metropolitan area and it's very difficult to get an appointment slot for dentistry. You know, a
Yeah,
lot of
that's
people
what I was
they
thinking.
want to use the OR for like open heart surgery or this or that or whatever. I'm fortunate enough that I think that the people in my community or the people at this hospital that I'm at, they understand the need for this kind of care. So I've been blessed that I've never had an issue with taking patients to the operating room.
Yeah, that's pretty excellent. And then like reimbursement for care that you do in the operating room. Does the
So
hospital pay
I
you? Does the insurance company? You know what I mean?
The hospital gets paid by the patient's medical insurance. And in order to be financially compensated myself, I have just a universal global fee that I do for, it doesn't matter the amount of dentistry I do. I go in there and it's a flat fee. So I could go in there and do 18 fillings and 3 extractions and a debridement, and I'll get paid the same amount as if it was 3 fillings, 5 extractions, and a debridement.
Yeah.
Because I just feel like that's probably the best way to, because I don't know what the treatment plan is until I actually get into the operating room.
That's great.
So it's difficult. I mean, it's it's like a box of chocolates. You don't know what you're going to get, and that's just the way that I felt is probably the most fair to all the patients that I have that need to be seen there.
For sure, for sure. And then does the hospital pay you? Does the special needs clinic area or the
No,
facilities?
so the patients, caregivers, that they are responsible for the fee, or the
Mm,
parents, but the hospital doesn't pay me anything. They just
yeah.
allow for me to utilize the space and the equipment.
Got it. Got it. Got it. So okay. So the insurance and the patient pays for the hospital, and the parents or caregiver needs to pay you for that. Okay. Yeah. That makes the most sense. This all makes a lot of sense to me. Oh, that's pretty good. And you like it. It's rewarding. Does it take time out of your schedule to book that in the OR or to see where do you see these patients for consults in your clinic as well, right? So then how much time are we taking out?
For the consultation,
Yeah, or like time out of your schedule to go to the OR. That's got to be a different day that you.
I
Is
mean,
it
pretty
once a
much
month that you
when I
go?
go there, it's an all day event. Like I get there at like 6 a.m. and check in is usually about 6 a.m., 6:15, 6:30. We do the huddle with me, the nurse anesthetist, circulating nurse, and then the head anesthesiologist. We'll do our little huddle and review the patient's medical history, meet with the parents, do over the consents, get everything reviewed
Hmm.
as a team that we're going to go back to the OR together. But we usually start the case probably around 7:30, and I'll typically spend anywhere from 2.5 to 4 hours in a case. I prefer to stand, so I'm standing the entire time in the OR, and I sometimes I could do back to back cases, but I'm pretty much wiped out the rest of the day.
Hmm. Yeah, that's a long time. That's a long time in the OR. I know what you mean there. Yeah, and then standing.
Well, you probably know that.
Standings.
I mean, you've probably been in the OR for like 10 hours.
Yeah. It is what it is, right? We got to do what we got to do. I like those memes that you send me of like the Long Island Italian accent things. I'm not
Oh, yeah.
Italian, but the accent's always fun to do, right?
Yeah, but I always think about you. I'm like, I have this guy. He's like a big 6'2", like Irish redhead guy, but he acts like he's like from like he's got like an Uncle Vinny and an Uncle Tony down the block, and I'm just like, it's just the funniest thing ever.
It's always I love it when you send me those. I'm actually watching The Sopranos with my dad right now, and they all got the classic New York area Italian accent, and
I just love it. Like I remember I did an externship at Stony Brook, and I remember this nurse I was talking to. I was just like, "Oh, I'm from Ohio." She's like, "Well, before you leave, you got to go to Porch Hog and Montauk. You got to get a cannoli from Jimmy's." And I was just like, "That is the greatest accent I've ever heard in my life."
I know exactly what you're talking about too.
I can't remember the lady's name, but she just looked at me like dead in the face and said that, and I was like, "This is the funniest thing I've ever heard."
Did you keep a straight face or did you crack up laughing?
I just kind of looked at her. I'm like, oh wow, like I gotta go to Jimmy's now. I gotta go give myself a cannoli.
Did you go? Did you go to Jimmy's?
I can't remember. That was like 5 years ago, 5 or 6
Yeah,
years ago.
yeah. That's true. That's true. Then we got Uncle Giuseppe's in Smithtown. Alpine Bakery is the bakery in Smithtown that people come from all over to go to, and that is where you got to get the cannoli. Next time you come out. Next time you come out to Long Island.
Yeah, next time I come out and visit you when you got your own private practice and you have like 4 or 5 associates working for you, just chucking whizzies every day.
Oof. Oh man, I would love to have that. That might be. We got to see how many years it's going to take to get that because I mean I got 2 years in associates at this practice, and I mean I'd really like to be a big part of that and grow it, and we'll see. It's private practice, so I'm hoping he keeps it private and maybe the opportunity to buy in the future. But it
And
seems like
nobody wants
everyone.
corporate. That's
No,
unfortunately
we
That's
don't.
unfortunately, I don't know what it's like in the specialty world, but in the GP world, I have a prediction that it's going to swing even harder to the corporate side. But then so many patients are, and so many dental students are going to come out and be like nobody wants to work at corporate.
I
I've
know.
never heard
I'm
one good
seeing a
positive
lot of
story. Like some people do, but like
exactly. Yeah.
it's far and few between for that I hear positive things. So I think that in the next 10, 15 years, it's going to swing the other way, and there's going to be a lot more private ownership of practices. At least that's what I hope.
The one thing, two things, a lot of dental students, so the DSO companies, they're opening up their own dental schools now, even, which is textbook conflict of interest, but they're doing it. Like High Point University in North Carolina,
Yeah, I heard about
Workman
that dental
School.
school, and I read their requirements on how they select students, and I'm like, that's the craziest thing I've ever heard. Like, it's a holistic review where they don't require the DAT, and they just like go off of a whimsical feel. And I'm like, so there's no more standards anymore, just let anybody in.
That's tough. And now you could always make the remark about the DAT where it's like, oh, well, some of the study materials, some of them like give you half the exam. Yeah, we gotta be realistic with what's out there. My one thing is, a lot of the dental students, they, it's like everyone in every career now, is there's so much debt that that's a very scary number. So I'm seeing a lot of dental students, and they graduate 400 a year from NYU, right? And of course, as you know, I went to Stony Brook, but I'm seeing a lot of students coming out of NYU. They just want to go off, start working, don't want to do a GPR. And I understand you don't want to do, you don't want to do any more years of education and training and exams. I get it. But are you comfortable with working? And I'm seeing a lot of confidence come out of NYU. And I'm seeing a lot of under trained dental students, especially in the area of surgery, and they get a lot of them get a good surgery experience. So it's just interesting to see, because I'm seeing a lot of them want to go into DSOs, and it's like they really just want big money, and I get it with the debt, but I think the confidence is a little bit out of proportion. You know what I mean? But the other thing you were saying with the it's going to switch back. I think it might switch back. The one thing we need is we need to start to see just the general population of people have a little bit less debt, have a little bit more purchase power, in order to kind of buy into that practice, to buy into that space and afford to build it up into the practice they want it to be. I do think it will get back to that point, because I mean, the general consensus is better dentistry is out of the private practices, right? The mom and pop shop. You come in, you see Aunt Lou, you see Lucy, you see treating the grandmother Margaret, all the way down to the granddaughter Betty Lou, and I don't know what the
Well,
name
yeah,
is,
I
but
mean, people want to feel like a sense of community, and they want to
yeah,
feel loved. They want to feel that they're being heard and listened to. And I get that finances are definitely a concern for many coming out of school. But at the end of the day, I feel like almost every single dental student or people who want to go into dentistry, like, why do you want to be a dentist? Why do you want to be a dentist? And it's, well, I want to help people. Why I want to help people? I want to help people? Like, that's okay if you want to help people, but I truly feel that if you are not going to give it 100% of your effort every single day, then you just shouldn't even get out of bed in the morning. And that
yeah,
goes
yeah,
like the MO on number 30, the post-op check on some nervous patient, the denture adjustment. A lot of those things are not very like fun or exciting or whatever, but they're a part of the job and they're part of just doing dentistry. And I think
right,
that you have to be committed to every single little step of the process, other than why are we doing this? And sure, you might not make any money on a denture adjustment or very little money on an occlusal filling or whatever, but like, you're trying to be of service to your community and the practice that you're in. And I don't know
yeah.
if a lot of these corporate models even care about the mom pop, the mission statement, the leadership, all those things. It's just make more production, make more production, make more production. And I get it why people want to do that, or I don't know. I just take a lot of pride and ownership in everything I do in dentistry, and it's just very important to me. So that's how I feel about it.
And that's why you're going to be an owner one day, Dr. Thomas.
Well, I certainly hope so, Dr. Gallagher.
What do you got going on after this? I've got to head over to the gym and train. I was gonna
I
modify
was
my
actually going to
girl.
go to the gym too.
Oh yeah,
So,
yeah, yeah,
yep,
yeah.
going to
What do
go
you?
do some chest and triceps.
Sweet, sweet. I'm gonna. Do you have LA Fitness in your area? What gym do you go to?
We do not have an LA Fitness. We have a Planet Fitness.
Yep.
We don't have an LA Fitness, but there's a whole there's a I'm actually an owner of a mom and pop gym down the street. It's owned by a cop, a state highway patrolman, and it's kind of like a weightlifting. It's just a big gym, but it's called gym therapy. He he called it that because he's like, this is a place where people get the therapy that they need. It's not about just like looking good. It's about
Mm.
like, I have so much sadness, anxiety, whatever the situation is. You can just go there, dump it off, and take care of your body. in your mind.
Yeah.
And yeah, do you go to an LA Fitness?
I'm not a part of a gym right now. That's why I love that's it's a mom and pop shop. That mission statement and is I bet you met the guy, right? Let me
Yeah,
guess.
I mean, I see him probably like once a week, but his name is
It's
Shane,
amazing.
and his name is Shane. He's always coming up to me, and I'll be like, "How are you doing today, Doc?" Yeah, but that's like those are like the little things that make you feel, I don't know,
At home,
homey, happy.
yeah.
Yeah, so I like that.
It's the
So
American dream right there. And then imagine you say your mom wasn't a dentist. To have that purchase power to go and open up your own practice down the road, you and your wife, that is the American dream. And
that is the American dream. So
right?
I hope that as a profession, I hope that more people who do go into dentistry can have that opportunity to open up their own startup practice, to buy an order doctor's practice with a good reputation and a good legacy, so that people can continue having these good experiences universally, whether it's in Ohio, New York, Florida, wherever the situation is. I want people to be just moving in a good direction. I think COVID really hurt a lot of those mission statements. I think it
Mm,
hurt a lot of those, why did we go to in this in the first place, of helping. So I hope that we can get back there.
I hope so too. I really hope so too. It's going to take some time, and I think the root cause. I mean, just it's another can of worms we don't have to open. But I really think the lack of reinsurance increases over the years. Just the reimbursement, it hasn't increased since 20, 30, 50 years ago,
No, when
and
people,
everything else
it's a
increases.
$1,500 coupon. That's what it is. It's a little coupon, and
It's the
people
exact same thing since
unfortunately don't understand
1970.
that. I guess that number of 1,500 was quoted when it was, because that was a price to remove all of a patient's dentition and make an upper and lower set of complete dentures. That was it.
Yeah, right. And that was the premium they got. What is it? The annual maximum benefit that they get year after year.
So, I mean, I think that something in that department is going to need to change. Otherwise, I do think that the ones that aren't in corporate settings, the mom and pops, will all just be forced to be fee for service because it's unsustainable. Like
It's not
nobody
sustainable.
nobody can accept all these PPO plans and get like a sweaty $20 bill for taking out, like doing an extraction. Like those days
Yeah.
are done. That's done. So, and then in the fee for service realm, I think that you're really going to need to separate yourself from the pack quite a bit
Mm,
to have a successful practice, because they're all going to turn into fee for service.
right. Right. Yeah. It's if that maximum benefit has increased with inflation over time, which is like what it's designed to be, like as insurance. It's like you don't have the money to pay for this treatment right now, but we're gonna. That's the whole point. You pay insurance over time to allow you to get when you at one time in your life that you do need it, that you get it. And I feel like that's just to trace inflation, right? By
Right.
definition. And yeah, if it did trace inflation, it would be $7,000 to $8,000 a year for every patient. That's what it would be. But it's still what it was in the '70s. So it
Yeah.
just blows me away. It blows me away every time. But yeah, I don't think anything is going to change from the insurance, but I do think it's the root cause. And I think at the end of the day, we got to create a new insurance company. But one day, we gotta work right now.
I would love to jump back on the podcast whenever you want me to. I don't know the other topics that you want to talk with me about, but I'm happy that hopefully I could shine a light on some special needs work. And also tell other general dentists that they too can do this. It's my goal to be able to kind of set a framework for other
Mm.
people to know that this does exist, it can happen, and it can be successful. So I think that that is probably my biggest goal with coming on the podcast today, is telling other general dentists that if they have a surgical inclination or a hospital inclination, that this is a route that they can pursue and it can help out a lot of people.
Yeah, man, 100%. That was a firework ending there.
Well, nothing short of a firework display for you, my friend.
All right, and yeah, and also just to chat too. It's all you see what I mean, like talking just the topics we chatted for the second half of it. I mean,
Yeah, it
it's
was
like
fun.
fun.
It
It's
was
like
fun.
going for
It was
one
just a
thing.
casual mom and pop, like down in Porchog, Montauk kind of talk.
Yeah, you gotta go get cannolis from Jimmy's. Come on.
Yeah, when I go to Smithtown, New York, I'm gonna have to go.
How you doing? All right, Mike, dude. A good call, good talk, good chat. We'll chat soon. All right, and I'll see you in the DM because we talk all the time there.
All right, sounds good. I'll talk to you later, buddy.
If you can just stay on for 30 seconds while it uploads all the file, it's like if you could wait 15 seconds, it'll be good. All right, man. I'll talk to you soon.
All right, bye bye.